Our witnesses today, and we have a plethora of witnesses, so we're going to propose that we just have the minister make an opening statement, and then we go directly to questions. If that's does the committee agree with that? We'll have opening statements by the minister. I guess that's approved. So first of all, I'll introduce our guest, starting from Mr. Perron, Michelle Perron, Canadian Institutes of Health Research, Vice President of External Affairs and Business Development. And we have Mr. Glover, Paul Glover, from the Canadian Food Inspection Agency, the President. And from the Department of Health, we have Deputy Minister Simone Kennedy. And from the Public Health Agency of Canada, we have Sidaka Mathani, President, and Teresa Tam, Interim Chief Public Health Officer. And of course, we have the Honourable Jane Philpott, Minister of Health. And Minister, if you'd like to open with an opening statement.
Thank you, Mr. Chair, and I appreciate being invited today to discuss Health Canada's 2017-18 main estimates and our proposed spending that's been identified as part of Budget 2017. Since I was here last year presenting the main estimates, I've had the opportunity to travel the country and to visit and hear from Canadians about the health issues that concern them, and I know that you as a committee have also heard from many Canadians, including those in Indigenous communities in the country. My career
as a doctor already led me to realize just how necessary it is to improve health outcomes for Canadians. My experience as a minister over the past year have confirmed this.
To discuss the resources that we as a federal government are putting towards making these kinds of improvements. Thank you, Mr. Chair, for announcing those who are accompanying me today, so I will not repeat those names. I'm pleased that they're here. Je prononcerai d'abord.
I will now speak briefly, and then I would be pleased to answer your questions.
In the 2017-18 main estimates, Health Canada is delivering on many priority initiatives for our government. These are going to result in approximately $4 billion in spending authorities for 2017-18. This is a net increase of more than $500 million from 2016-17, and there will be additional significant investments that were outlined in Budget 2017 that will be identified through future supplementary and main estimates exercises. J'aimerais mettre en lumière certaines des
I would now like to highlight our government's health priorities and the measures that we are taking to follow up on them.
The healthcare system, as you well know, is a great source of pride for Canadians, and the federal government, along with our provincial and territorial partners, recognize the need to strengthen the healthcare system so that it adapts and innovates and addresses the many new challenges that Canadians are facing every day. I'm pleased that almost all jurisdictions now have accepted our federal offer of new investments in healthcare, with significant new money in particular shared areas, shared priorities, including mental health and home care. You will note that over the next 5 years, the Canada Health transfer amounts provided to provinces and territories are expected to total approximately $200 billion, providing long-term, predictable and growing funding to our provincial and territorial partners. This year's funding, for example, will be approximately $1.1 billion higher than it was last year. And as part of our deliberations with the provinces and territories, we identified some particular healthcare priorities, specifically mental health and home care. One thing I learned as a doctor, and no doubt you all understand as well, is that there is no health without mental health.
In recent months, I had attended meetings in Eastern Canada, and I also led a roundtable in Toronto. And stakeholders spoke about what we could do to improve mental health services, particularly the services to youth, and also the need to follow up on these improvements.
Canada about both the importance of mental health and the large number of Canadians who are affected by it. Indeed, most Canadians are affected either directly or indirectly on matters of mental illness. And there's a recognition as well about the tremendous importance and the rising need on home care. As we may have discussed before, some 15% of hospital beds are currently occupied by patients who would prefer to receive their care at home or who could be better off in some kind of community-based setting. And so Budget 2017 proposes to provide $6 billion over 10 years for home care and $5 billion over 10 years to support better access to mental health care. These initiatives will make Canada's healthcare systems more responsive to the needs and expectations of all Canadians.
Two other priorities were raised during the discussions leading to a renewed health accord: making prescription medications more affordable and ensuring that health care is more focused on innovation.
Drug prices. Budget 2017 proposes to invest $140 million over the next 5 years. This will support important work by Health Canada, by the Patented Medicines Prices Review Board, and the Canadian Agency for Drugs and Technologies in Health. To expand e-prescribing and virtual care initiatives and the adoption and use of electronic medical records, we propose $300 million over the next 5 years to support Canada Health Infoway. We also propose to invest $51 million over 3 years in the Canadian Foundation for Healthcare Improvement to help accelerate innovation in our healthcare system. And we plan to invest $53 million over the next 5 years for the Canadian Institute for Health Information to improve decision-making and strengthen reporting of health-related principles and outcomes. Based on observations from my own travels to First Nations and Inuit communities across the country, I believe very strongly that improving the health of Indigenous peoples in Canada must be a priority for our government. La Commission de Vérité et de
The Truth and Reconciliation Commission asked the federal government to address gaps between the health outcomes of Aboriginal communities and the health outcomes of non-Aboriginal communities. And that is exactly what we are doing.
In 2017, we're proposing to invest $813 million in new money for health services for First Nations and Inuit. This includes new money to increase community-based infectious disease programming, to expand access to nurse practitioners as well as physician services, to increase access to mental health and wellness services, and new money to increase home and community care services on reserve. As you'll note in the main estimates, Health Canada's funding for First Nations and Inuit health programs will increase by approximately $440 million this year. This will include $82 million for major repairs, expansions, and new construction of health infrastructure such as nursing stations, health centres, and acute care facilities, as well as drug and alcohol treatment centres. The estimates also include support for 3 other related matters: $58 million to continue in implementing our legal obligations under the Indian Residential School Settlement Agreement, $27 million to provide First Nations communities on reserve with access to safe, reliable water and wastewater systems, and $25 million to address urgent mental health needs in these communities. Finally, we will also invest this year $137 million in interim reforms related to Jordan's Principle. This will ensure that First Nations children on reserve have access to the same publicly funded health and social services as other Canadians and that no child falls through the cracks. The need for this action is obvious. In July of 2016, we announced funding of $382 million over 3 years, and since then, more than 3,300 requests for services and supports related to Jordan's Principle have been approved for First Nations children. Another health priority we're addressing is our country's opioid crisis.
I traveled to British Columbia and I went to see those who are on the front lines of the crisis, the first responders who are called to intervene at overdose cases time and time again, the families and friends who are grieving the loss of a loved one. I also take this opportunity to thank the committee for the work that it has completed to date, particularly accelerating the passing of Bill C-37 by Parliament.
And our response must be comprehensive, collaborative, compassionate, and evidence-based. En décembre dernier, j'ai annoncé.
Last December, I announced the Canadian Strategy on Drugs and Other Substances, which will replace the currently anti-drug strategy. It sets out the harm reduction as one of the key pillars of our policies, in addition to prevention, treatment, and the enforcement of the Act.
$65 million over 5 years for national measures to respond to the crisis, and Budget 2017 proposes an additional $35 million for a total of new investments more than $100 million over the next 5 years. Our government is well on track as well toward legalizing, strictly regulating, and restricting access to cannabis. On the matter of CFIA, the health of Canadian families depends on access to safe and nutritious foods, and to help strengthen Canada's world-class food safety system, Budget 2016, you'll recall, provided $38.5 million over 2 years to invest in systems that focus on high-risk domestic and imported foods. Budget 2017 continues this direction, proposing to provide up to $149 million over the next 5 years to the Canadian Food Inspection Agency to carry out this work. Ces fonds permettre
These funds will allow the CFIA to implement more rigorous, uniform food safety regulations, in addition to modernizing basic food inspection programs. Thus, Canada will be better able to prevent, detect, and minimize the risks tied to food safety.
2017 will require that agencies across the health portfolio continue to collaborate on many health priorities. For example, Budget 2017 proposes to allocate $47 million over 5 years to Health Canada, the Public Health Agency of Canada, and the Canadian Institutes of Health Research to develop and implement a national action plan to address the broad range of health risks associated with climate change. So I'm confident that the amounts noted in our main estimates and the funds identified in Budget 2017 are going to help us to continue to support better health outcomes for all Canadians and to build a healthier country. So I thank the committee once again for inviting us to join you today. We're grateful for your contributions, and I'm certainly looking forward to your questions.
And thank you very much for your presentation. My understanding is you have to leave at 12, is that correct?
Yes.
Okay, so just so that the members know, the minister is leaving at 12. The officials will stay later for more questions. So the other piece of news is that the thalidomide information will be here by Monday, April the 10th. So we'll have that and we'll distribute it. The clerk has been notified that we'll have that. All right, we're going to start our 7-minute round of questions with Mr. Kung.
Thank you, Mr. Chair. Thank you, Minister, for the broad and detailed testimony. In a brief time, short time, I think you literally gave us the whole plan. Thanks for that. My question, before I ask my question, Mr. Chair, I want to share my time with Ms. Sidhu. Thank you. Minister, my questions are around the First Nations and Inuit health programming. Priority number 3 of the 2017-18 Departmental Plan, Health Canada 13, is to strengthen First Nations and Inuit health programming. One of the key initiatives to support that priority is to address the Truth and Reconciliation Commission health recommendations, including mental wellness programming. In its report and recommendations on the opioid crisis in Canada, this committee recommended that the Government of Canada commit to providing stable needs-based funding for the First Nations in order for them to implement the First Nations mental wellness continuum framework. What consideration has Health Canada given to providing funding to the First Nations in order to implement the First Nations mental wellness continuum framework? And what mental wellness programming is being considered by the Health Canada? Will this programming be available to all Indigenous people or restricted to the status Indians and Inuit? Thank you.
Thank you for an excellent question. This is an important one, and in fact, I think there's much good news in Budget 2017 as it relates to this matter. As you've indicated, there are a variety of reasons why this needs to be a priority for our government. One that you've pointed to is the fact that the Truth and Reconciliation Commission made a number of recommendations to which we're obligated to respond. 11 of those specifically speak to health issues, and I think that it should be no surprise to this committee to recognize the fact that on any broad range of metrics, there are unacceptable disparities between the health outcomes enjoyed by Indigenous Canadians as compared to non-Indigenous Canadians. So it's of the utmost urgency that we work to address those disparities, and to that end, I believe that the investments in this budget will be very helpful. There is, as I indicated, $813 million of new investments in a whole range of areas. We have worked with our Indigenous partners, leadership in First Nations and Inuit communities to specifically clarify where their needs and priorities are. This is the largest single investment in First Nations and Inuit health overall in well over a decade. And in certain areas such as home care, which we know is a priority that's been identified by Canadians, this is the largest increased investment in home care in Canadian history for First Nations and Inuit. So this is good news. There's a tremendous amount of work to be done. You spoke to the matter of mental wellness, and I'm glad that you noted in particular the mental wellness continuum framework, which has been established by First Nations, and certainly the investments in mental health in the budget will be incredibly important in allowing that continuum framework to be implemented fully, and we look forward to working with our partners in First Nations communities to specifically address that framework. And we believe that the investments made last year to augment mental health resources, in addition to the new investments coming this year, will go a long way to responding, and I'd be happy to provide any further specific details that you'd like.
Thank you, Mr. 3.5 minutes, or?
We're halfway done. You have 3 minutes left to go, so you should probably switch.
Okay.
Ms. Sidhu?
Thank you, Chair. Thank you, Minister. Thank you for coming today to talk to us as a committee. I know that our government has a historic investment in home care will make a big difference in our communities. Can you please explain what this adjustment will mean to the community across Canada, and then over almost $2 billion in Ontario for home care? How you think, I know it's a territory and province's responsibility to deliver that, but how are you seeing that will be delivered?
Thank you again for a very good question. So you're absolutely right. The investments in home care are very important for the long-term sustainability of healthcare systems across the country. We all know that healthcare is one of the is the largest single budget item on the books of our provincial and territorial colleagues, and that there are ways that we need to make sure that as Canadians public funds are used for home care, that they are used in a way that there's good value for money. So we know, for instance, that some of the most expensive ways to deliver care are in hospitals and by physicians. Health experts, as you well know, will say that one of the ways that we can do better is to be able to get care into the communities. So we're very pleased that as we worked with our provincial and territorial counterparts, that they agree this is an area of priority, and that we were able to offer additional resources on top of the growing Canada Health Transfer specifically for home care that will allow that transformation of the health system to get people out of hospital and get the care they need at home. To date, I've had really excellent opportunities across the country to meet with home care providers and to meet with provincial officials and experts on this, to see the kinds of ideas that provinces have about how they want to use this money. We expect to come together in the near future with all provinces provinces and territories to talk about specifics as to how they will use those new investments in care, and also importantly to agree upon a series of metrics or national standards as to what Canadians can expect, so that we will be accountable to Canadians and for making sure that the investments that we make in home care will in fact go to improved access to care.
And when will the fund provided under this agreement begin to flow?
Well, there are specific arrangements that are being made as we speak in that regard. In terms of how quickly the funds flow, I know that it's important that it is done as quickly as possible. I don't know whether we have a specific date on that, do we?
The plan is to try to ensure that we have further conversations we have to have with the provinces and territories, but to have the first year of funding flow fairly quickly. So we're looking at what the mechanisms would be to do that. And so I think the idea would be to get going, put some of that money out fairly quickly in year one, without having the conversations we need to have on the details, slow that down. So that we've already told the provinces and territories that's the intention, and we're working with the government to figure out what the best mechanism is to do that.
Thank you. Thank you.
Dr. Carey.
Much, Mr. Chair, and thank the Minister for being here for the estimates. I almost feel bad for you, though, having to defend your government's irresponsible fiscal management, but I only have 7 minutes, so I'm going to get right into the questions. I have 3 to start, and if you don't mind, I'd like to ask them all. The first one being, in the budget, there was a mention of public education programming and surveillance activities for marijuana, and given your government's priority, I was wondering if you could define that for us. The second one is in regards to vulnerable Canadians who depend on medical marijuana. They trusted you and your government to ensure that what they were using was regulated and, more importantly, safe. That was the promise. However, we found out that dangerous carcinogenic fungicides were being used in medical marijuana. Obviously, the current inspection system isn't working. So the second question is more money being allocated to inspection following the recall of medical marijuana products that were putting vulnerable users at risk? And the third question was, are proper inspections actually now taking place? And if so, how many have been done?
Thank you very much for those questions, and I'm very pleased that you identified within the budget that there are investments around the matter of public education. As you know, when it comes to the matter of cannabis, that our government has made a commitment to work toward legislation that will legalize cannabis and regulate it and restrict access for the purpose of keeping cannabis out of the hands of kids and the profits of this industry out of the hands of criminal organizations. And so to that end, one of the very important recommendations we received from the task force is to make sure there's a broad public education campaign. So I believe the number is $9.6 million that's been identified in the budget to begin that. There's been some very important work done by the department in developing what that public education campaign will look like. The very beginnings of it have started to roll out, but I know people will look forward to seeing an expansion to that. There is ongoing funding in that, and of course when the legislation is tabled, it will be important that we appropriately resource this important aspect of public education.
So no details yet?
I'm not sure that we're at liberty to give a whole lot of details. Some of it relates to, of course, things like social media campaigns, making sure that we get the right information to the right audiences. We know that young people are those who are often most at risk, but of course their parents are also very interested. So we're looking at different kinds of platforms to make sure that the message gets out to the right audiences in that regard. Do you want me to move on to your other parts of your questions for the sake of time, or I can ask for some clarification?
Will be here, we can get that detail.
On the matter of inspection, I'm glad that you raised this, and in fact, the regulations around security and safety of the medical cannabis industry in Canada, in fact, are extremely rigorous. And in fact, other countries in the world come and look to our programs to make sure that as they look to regulating a similar type of industry. And Health Canada does conduct regular and unannounced inspections of the licensed producers who are given authority under federal regulation to produce medical cannabis. We have announced that as a result of the information that you described, that we will in fact now do random testing as well, in addition to the regular inspections of licensed producers. And I don't know whether my deputy wants to elaborate on that, but in terms of the rigor, but we want to certainly assure you that continued work is being done to be sure that we have all the right inspection processes
Well, I
in
was
place.
wondering if resources set aside, because this is not only for medical marijuana, your government has promised in a very tight line, tight timeline to roll it out for all legalization for Canadians. And what we're seeing is the inspections, obviously it wasn't working if you're getting these fungicides. So really I just wanted to know, are more funds being allocated for it? And are proper inspections now taking place? And if so, how many have actually been done since we found out about this problem?
Thank you. So obviously I can't give details right now on what the legislation is going to look like and the process by which.
Is there more money though?
I'm not at liberty to be able to share the specifics of the legislation until it's tabled. But I want to remind the committee that in any production, whether it be the production of toothpaste or of lettuce or pharmaceutical products, part of the strength of Canada's regulatory system when it comes to consumer products, when it comes to food safety, when it comes to pharmaceutical products, is to make sure we have strict systems in place to identify if there are contaminations. And in fact, contaminations do happen from time to time, and that's why we have systems in place to recall immediately, as was done in these circumstances, to make sure that people are aware that something has been identified, and then to be sure that the systems are in place so that we will always be able to make those identifications as quickly as possible and inform people who might be at risk. But perhaps you'd be reassured by some comments from my deputy in that regard.
So just to reinforce what the minister said, I mean, we certainly have been taking very seriously these recent violations around pesticides. We've begun a program of randomized sampling to kind of keep the industry on its toes. There is right now a very kind of strict list of which pesticides are authorized for use in the cannabis sector, and so that random program is going to be looking at that. What I can say is that generally we have found, certainly in the last number of years, a very high rate of compliance in the industry, and generally speaking, as the minister indicated, there's a fairly heavy schedule of inspections and oversight that takes place now. So obviously we've had these incidents. We've adjusted the program to add this as a new dimension. The other thing I would point out, without in any way wanting to minimize what was discovered, and we are taking action, but the department did do a risk assessment when these breaches were discovered.
Now, did you make it mandatory, the testing? Because understanding from the article, you didn't. And is it mandatory that these companies are all going to be getting inspected? Random is good, you know, keep them on their toes, as you said. But are you inspecting these companies, and is it mandatory, yes or no? Because I really have run out of time.
I think we want to see what the results of the randomized program indicate before we make a decision about what a final regime would look like. I mean, to date, we have not seen any information to suggest that we need to have a program of inspecting every batch lot of every company.
No, but mandatory at each company.
Well, right now we have mandatory requirements around pesticide use, and the randomized inspections are designed to determine whether or not the companies are actually kind of following that protocol. And that's frankly pretty typical in the way in which inspection regimes function. It's actually, in many regimes, you're not actually looking at every single lot. You're kind of pulling them randomly to sort of get a sense of whether people are following the rules or not.
And do you have a number of how many inspections you've done?
I'd have to get back to you with that, sir. At this point, I don't have it.
Thanks.
Yeah.
Mr. Davies.
Thank you for being with us and to all of your staff. Minister, I want to start by congratulating your government for increasing funding to the Global Fund to combat HIV and other maladies internationally. However, I want to ask you about funding for organizations here in Canada. Last year, it emerged that the Public Health Agency of Canada had expanded the number of agencies deemed eligible for support under the HIV and Hepatitis C Community Action Fund, but that the fund itself would remain fixed at $26.4 million. Under this new allocation, many established community-based organizations either lost funding or had it significantly reduced. Now, I know you have pledged to address this for this current fiscal year, 2017. fiscal year. So can you confirm that the previously funded organizations, all of them, have in fact been made whole with full transitional funding for this year? And more importantly, will you commit to providing these organizations the same funding in the years ahead to come through an expansion of funding to the federal initiative on HIV and AIDS?
Well, thank you for the question and for highlighting this important issue. And you're absolutely right. It's an issue that has global relevance. And like you, I'm pleased about our government, our country being able to support further investments in the Global Fund. In Canada, we have a tremendous amount of work to do on these issues like HIV and hepatitis C. And I like you, I'm recognizing that there's more work to be done. One of the things that we have increasingly done in the health portfolio is to bring together all partners to recognize the important role that each of the members of the health portfolio have on the matter of HIV. So we've increasingly made sure that the Public Health Agency of Canada is working closely with First Nations Inuit Health Branch, is working closely with Canadian Institutes for Health Research, because all of the groups within the portfolio have a role to play in that. I'm very happy to say that, in fact, we did get new investments in the budget to expand the federal initiative on HIV in the order of $30 million of new funding that will support this. What that will allow us to do is to be able to look at the very questions that you're asking in terms of these groups who had concerns about potential funding cutbacks. I will ask the President of Public Health Agency or Dr. Tam to clarify whether, in fact, every single organization was able to get bridge funding to make sure that it continued right through until March of 2018. But with this new funding that came in the budget, we will, of course, be looking at all of those groups to make sure that we provide good, smart investments going forward for the groups that are delivering well on the ground. Did you want to comment on that?
Minister, if it's okay, I'm going to move on to some of those. That answers my question sufficiently. I want to talk about the opioid crisis. Minister, as you may be aware, Vancouver Fire and Rescue Services reported 162 overdose response calls for the week of March 20th. So just a few weeks ago. That's a 56% increase over the previous week, where 104 calls were responded to. To date in 2017, there have been 100 overdose deaths in Vancouver. There were 215 in all of 2016. So in the first quarter, we're almost halfway there. If rates of overdose deaths continue at this pace, Vancouver will see nearly 400 deaths in 2017, double the number recorded in 2016. We know fentanyl is spreading across Canada to many communities, and that carfentanil is ever present. But when I looked in your budget that you tabled last couple weeks ago, on page 193, there's a line that says emergency funding to address opioid-related public health emergencies. And it has the $16 million that you allocated in 2016 to BC and Alberta, $10 million to BC, 6 to Alberta, and nothing but zeros thereafter. So my question is, given that the opioid crisis is not under control, given that we have reason to believe it may even flare up, can you explain if you think it's prudent not to set aside emergency funds to deal with the opioid emergency over the years ahead? Is that a prudent way to budget?
Well, thank you for the opportunity to clarify the significant investments that are in Budget 2017 related to the opioid crisis. I know you and I both were involved in the very important policy forum that took place over the last couple of days here in Ottawa to discuss this, and there's no question that this is a crisis of unprecedented proportions, requiring all of our efforts to be able to address the realities that you've eloquently described in terms of the number of people that are dying. In the time that remains, what I can say to you is, yes, we provided that $16 million of an emergency funding directly to those provinces who are facing the crisis in the most severe ways. But in fact, there are significant new investments. The Canadian Drugs and Substances Strategy has ongoing funding in the budget. We did not take anything away that was previously there, and it was designed, and it had been allocated to the level of $570 million over the next 5 years just for that strategy alone. We were able to bring a 20% increase to that, bringing the total investments in the Canadian Drugs and Substances Strategy an additional more than $100 million to be able to amplify that. But I also need to make sure that you know that this is a problem that has widespread implications and requires a comprehensive response. And that's why we did things like the $5 billion investment in mental health. You know the links between mental health and the opioid overdose crisis. You also know that investments in things like housing, $11 billion to our national housing strategy, will go a long way, because this is not a crisis that's going to be fixed overnight, and it requires all those social determinants of health to make sure people have access to employment, that they have access to safe housing, that we get good health care. So I will work with you. This is not a political, not a partisan issue. This is one of the most serious public health crises that we have faced in this country, and we are determined to turn it around. I look forward to working with the community.
I agree with all that, but the question was on emergency funding, and that's, I mean, the budget line is there, and I'm just surprised the government hasn't allocated any to emergency. We could have a flare-up on this crisis next week, and the fact that there's no emergency funding budget for, I just think is an omission. I want to move to pharmacare and pharmaceuticals. Your mandate letter tasked you to improve access to necessary prescription medicines. And it went on to talk about looking to join in bulk buying to reduce the cost that Canadian governments pay for these drugs. So you well know that 1 in 5 Canadians report not taking medicine because they can't afford it. It's been estimated 20% of Canadians, 7.5 million Canadians, do not have access, stable access to the medicine they need when they need it. So my question is, I know you're only 18 months into your mandate, but that's a year and a half. Has access to prescription medications improved for Canadians since you have taken office?
Thank you. I know I probably don't have very much time. I first of all want to thank the committee for your work on the pharmacare study. Very much looking forward to the results of that. As you know, I know the interests of you and others around the table in the matter of making sure Canadians get access to care. What I can tell you for sure is that there has been progress made in ensuring that prescription medications are more affordable and therefore accessible and appropriately prescribed. One of the things I can point to is the bulk purchasing plan, which we joined with the provinces and territories, which is on track to save something in the order of $700 or $800 million a year now, bringing down the prices of those drugs and therefore bringing down the cost to the public. And I will look forward to giving you more information about how we're bringing down the cost of medications overall, and working with provinces and territories around things like a national formulary, all absolutely essential steps in making sure that prescription medications are available to Canadians.
Thank you very much. And now Mr. Oliver.
Thank you very much, and thank you very much for the leadership you've been providing for a very important file for all Canadians. Great to have you as our Minister of Health. My first question is around the opioid crisis that we've been dealing with and fentanyl. So wonderful in Bill C-37 to see a return to evidence-based harm reduction approaches to this crisis, which is a big change, I think, from what we had in place before. So with C-37 coming forward, can you tell the committee, are we seeing easier access to safe consumption sites? Are we starting to see prescription changes? Are naloxone availability, are you sensing a turn here?
Well, thank you for the question. It's a kind of a sobering reality, the circumstances, and Mr. Davies has highlighted some of what's actually happening. And I think we are seeing good progress, but this is a crisis that has kind of been bubbling up for some time. Yes. And I think just to manage people's expectations, while I would like to be able to say that it's going to turn around immediately, we have to realize that it's taken years to get to where we are, and it's going to take some time to turn this around. But I am pleased with the progress that's been made. You asked specifically around Bill C-37, and I once again want to reiterate my thanks to this committee for your expeditious work on that, because you'd already studied the matter and were able to move it through. We look forward to the passage of that bill. I hope it will be very soon. I met with the Senate committee last week. I know they're still taking hearings, but I hope that we will see that move through very, very quickly. I was able to, just a few weeks ago, announce 3 new supervised consumption sites in Montreal that were working under the previous legislation, but it took them 18 months in the application process to get to that point. We now have another 10 or 11 sites in the queue. If we can get that bill through quickly, that really changes the landscape in terms of what it requires, not only for those who are in the queue, but for others that will come after them. And so we hope to be able to announce new sites as possible in the future. And I want to just once again remind the committee that while access to supervised consumption sites in communities that want and need them will be effective in saving lives and reducing suffering associated with substance use. This is one of a whole range of measures, and we always need to keep our eye on the comprehensive response to this crisis.
Okay. Just from one of the witnesses that we heard testimony from, because we did our own study on this and released our 38 recommendations, was the importance of distinguishing treatment and addiction treatment. It's often lumped under mental health, and too often the funds for addiction end up in general mental health pools. So there was a very strong appeal from a couple of physicians to make sure that we do address addictions and that we have good treatment centers available across Canada, because that's one of the biggest barriers right now. When people identify themselves as ready to look for treatment, can we get them quickly into centers? So.
Well, I'm very pleased that you raised that matter. You know, I think
it's provincial, but... Yeah.
Pardon me?
I know it's provincial, but... Yeah.
Well, it is provincial, but I think there are ways that we can signal our support to encourage expanded access to treatment for people with problematic substance use. There's no question that the matter of mental health and addiction are very, very closely related, and it makes sense to talk about them together. But you're right that sometimes the fact that we link those together because they have interrelated themes can mean that sometimes resources don't get to the addictions or problematic substance use in the way that they should. So one of the things that I am certainly trying to do, and there are ways that we can do it, including I'm thinking in terms of working with our partners in research who are helping us to look at expanded access to treatment, is indicate that yes, we need to do far, far better in this country on treatment, both the mental health support treatment that people need, the social support treatment that people need, but also the medical support for people with problematic substance use, including access to medication-assisted therapies, opioid substitution therapies, for example. And there are ways that within our federal leadership that we can try to move that along and make sure that there's better access, which there certainly is a big challenge on right now.
Thank you. And in the estimates, there's an increase of about 30% for First Nations and Inuit primary health care. I'm just wondering, can you share any recent success stories in this area? I heard there's some changes in the maternal accompaniment plan. Any other things like that? Could you maybe just share with the committee some success stories? I know there's a lot of challenges, but you're making progress. So.
Yeah, again, great question, because I think sometimes we don't do a good enough job talking about the good news stories of things that have happened. And there was money in the budget last year, as you may recall, around health infrastructure on reserve. And there's some good news stories. I had the opportunity to go out to Cross Lake in Manitoba and talk to them about being able to support an expansion of the nursing station there, which they were ecstatic about, and it was long overdue. But you asked about sort of other things within the sort of broad range of health services, and I think I would like to take this opportunity to highlight one of you referred to prenatal issues. I have become increasingly aware about the importance of wellness at the time of birth for all Canadians, but in particular there are real challenges for Indigenous Canadians, many of whom live in very remote communities and are forced to leave their communities to give birth, and the results of that have essentially lifelong implications for the mothers and the children. So 2 things in the budget that I am beside myself with happiness over is number 1, we were able to change the policy on prenatal escorts. So up until now, a young woman, some of these young women are teenagers, that have to leave their community and give birth in a faraway city, unless they had a medical reason for it, couldn't bring someone with them, and they have to leave 5 weeks before the baby is due and stay for a number of weeks afterwards. This is not a healthy policy. We were able to change that so that now every woman who has to leave her community to give birth is able to bring an escort with her. Incredibly good news. The other thing, I know the chair is looking at me and my time's about to run out, but you have to also know that one of our longer term goals in that is to be able to use the words of a First Nations leader to restore the cries of birth to remote communities in Canada and find ways that we can expand midwifery, expand access to allow people to give birth in their homes, in their land, surrounded by their families.
Thank you very much. And now we're going to go to our 5-minute round, starting with Mr. Weber.
Well, thank you, Mr. Chair, and thank you, Minister and staff, for being here today. Minister, as you are likely well aware, there are hundreds, if not thousands, of Canadians suffering daily from Lyme disease. And we know that there are many more likely who have been misdiagnosed or are not getting the treatment that they need. We've had conferences, we've had experts provide their opinions and recommendations, and we've had public consultations. The Lyme disease community believes enough talking has happened, and now action needs to take place. We know that action is not possible without adequate funding. So my question to you, Minister, is can you tell us how much extra funding over and above that from previous funding has been allocated to implement a Lyme disease action plan?
Well, thank you for your question, and you're right that this is an important issue that certainly many of us hear from, and in certain parts of Canada in particular, it's a real challenge. I'm pleased that we were able to host a conference recently to develop a federal framework on Lyme disease, and the draft result report associated with that has just recently been proposed. There are many things that we as a federal government can do, of course, and we will work towards those, and I'll ask my public health colleagues to expand on that to a certain extent. There's a great deal of work that needs to be done in public education and making people aware of the risks, and there are ways that we are doing that through the Public Health Agency, but also working with provincial and territorial partners to get the message out to Canadians as to how to prevent Lyme disease. There's also a lot of work that needs to be done with healthcare providers to make sure that they recognize it early, get the diagnosis, and get
Absolutely,
the treatment
Minister.
to people.
I don't mean to cut you off. I want to just know about the actual funding. I only have a little bit of time here. So can you give us any detail on the funding that will be allocated and spent on Lyme disease?
Can I get, I don't know which of you is better positioned to do that. Teresa, perhaps you can give us some specifics.
Yes, so within the Public Health Agency of Canada, we're strengthening surveillance, education, awareness, and looking at where more information or more knowledge is needed. So we are leveraging essentially on any funding that we may have under climate change, because we're looking at expansion of mosquitoes, ticks, and vectors, including Lyme disease. And we'll be trying to look at how we can leverage that funding. And as the Minister said, there's additional funding, and we will be looking at some of that. That includes grants and contributions as well.
Okay, well, thank you. I appreciate that. Obviously, I'm not getting any numbers here.
If I may just say, I just wanted to clarify what the actual number was. So what Dr. Tam was referring to is $47 million of investment in health-related health risks associated with climate change, and of course Lyme disease is one of the priority areas within that regard.
Okay, will it be only go to federal spending, or will it be targeted funding given to provinces? And will that money flow in this fiscal year, or is it subject to a lengthy application program that actually means that funding will be reprofiled for future years? Exactly what part of the battle against Lyme disease will see extra funding this year, and in what amounts? That's what I'm asking. I just need numbers.
So I'm happy to get you the breakdown on that $47 million. I don't have it at my fingertips, but we'll be happy to get that to you.
Thank you.
And that's
Appreciate that.
federal investment. I think it's also really important to recognize, as you've alluded to, that a large part of the diagnosis and treatment of this is provincial and territorial, and obviously to their discretion.
All right, thank you, Minister. I'm sorry, I don't mean to cut you off. I've only got a minute here. I do want to bring up another topic which is of deep passion to me. Last year, one of my colleagues, MP from Edmonton Manning, Mr. Ziad Aboutaif, last year he brought forward a legislative proposal for a national organ and tissue donation registry. The concept was well received by many Canadians, and his efforts were voted down by the Liberal government. And that vote, it did see a few Liberals, including our chair, thank you, Mr. Chair, who voted in favor, but it was defeated. Of those who opposed this life-saving idea were you, Minister, and also MP Judy Sgro, the member from Humble River and Black Creek. So imagine my surprise, Minister, when I saw a few months later on November 28th of 16 that Ms. Sgro tabled motion 98, which reads as follows: that the House underscore its desire and commitment to establish a national organ donor registry and call upon the government to engage with provinces, territories, and other relevant stakeholders in an effort to devise and enact the legislative and regulatory framework necessary to establish the same. So I'm just asking, Minister, can you explain this? How can the Liberals vote against a national organ and tissue donor registry in June and then propose one in November? Is the government admitting that they made a mistake and are now willing to support such a great initiative? Or is this a case of a government being so determined not to vote in favor of a conservative bill, just to be able to say that they passed a Liberal motion instead? I sure hope that this is not the case, because people are dying, Minister. So can you explain this to me?
Thank you. And let me preface it with two comments. One, first of all, to say that I hope that you and the committee are very well aware of the fact that health of all issues that governments face is not a partisan issue, and I will not make decisions on the basis of partisanship. My priority is to the health of Canadians, and that is on that basis that I make decisions. And secondly, I think I need to say thank you for your leadership on the matter of organ and tissue donation, which is incredibly important, and I will agree with you that there's a tremendous amount more work to be done, particularly in the area of encouraging Canadians to participate, and I think that you and I would both agree that there's much more work to be done in terms of the donor community being increased. One of the challenges around the motion and indeed any of the areas on this is when we wade into provincial and territorial jurisdiction, it gets complicated. I would look forward to the opportunity to work with you, because I know this matters to you so much, and to many of our other parliamentary colleagues, to figure out better ways that we can figure out where our federal role lies and how far we can push it without invading into provincial and territorial space, with the ultimate goal of making sure that we increase the donor base.
Thank you, Minister.
And now we'll go to Mr. Ayoub.
Merci, Monsieur le Président.
Thank you, Mr. Chair. Thank you, Madam Minister. It's always a privilege to give you the opportunity to explain to Canadians the leadership that you are giving to negotiations with many provinces on health, particularly in Quebec with respect to home care, and I'll really insist upon that, and mental health. In my former life, citizens came to see me when I was mayor to find solutions to be able to stay at home, because elders, seniors and others want to keep their families at home. They don't want to go into institutions, particularly, unless they're forced to by the nature of their care. I would like you to explain to us, in the recent months, the negotiation and leadership that you have contributed as a federation to give Quebec and the rest of the country the idea of home care and mental health, which is really without precedent in the recent budget. Thank you. Thank you very much. I will try to answer in French. I might have to change languages, and I congratulate you on your French, because I've seen daily improvements in it. Thank you. Thank you. As you know, we had very good discussions with all of the provinces and territories, including Quebec, and I know that Minister Barrette also said very clearly that the priorities that we share are things like mental health and home care. And I saw a number of good examples of this. For example, there is a facility in Montreal for palliative care, and I visited it. It is a very good example of the excellent work being done in Quebec. During the discussions, it was clear that the things that you said are priorities for Minister Barrette and his government. We discussed how we can increase services. They have very good ideas about mental health services for youth.
One of the Minister Barrette has identified some really excellent programs that they're very interested in for youth. They have, in fact, looked to international communities. I don't want to presuppose what their plans will look like, but just to give you a bit of an idea of the things that they are looking at there. We know that when we get care to young people, that it can have a lifelong impact on them. We know that young people are not often identified as having mental illness early enough and don't have access to care. And I know that Minister Barrette and his government are looking at expanding programs for young people to get access to cognitive behavioral therapy and using some of the very best world-class models in that regard. The funding that we gave to them, they will make decisions on the basis of how that funding is spent, but I know that you can assure your constituents that they should see improved access to mental health care as well as home care in the years to come as a result of our investments.
J'en ai pleinement confiance.
I have full confidence in you. We've also been speaking about the opioid crisis. It's much more of an issue in the west of the country, but it seems to be on the rise in the east, particularly in Montreal. I was reading recently about the excellent relations with Minister Charlebois to encourage new sites to open, and sites that Montreal could benefit from. In the minute that remains, could you please talk about the opening of these sites and the process to open them? Well, as you know, I recently announced that there are 3 sites in Montreal for supervised injection sites that are ready to be opened. They received an exemption.
With Minister Charlebois, who's very determined to address this. I may also say that the Mayor of Montreal, I had a conversation with not very long ago about his concerns about the opioid crisis in Montreal. I would say that they have actually been highly proactive, and I think this is good news. It has not reached Quebec to the extent that it has in other provinces for a variety of reasons, but I think it's good that this is very much on their radar, and there's a lot of good work being done there.
C'est ce qu'on appelle le travail d'équipe et le leadership.
That's what you call teamwork and leadership, and I congratulate you for it. Thank you, Mr. Chair.
Much, Mr. Chair. Minister, in March, you refused to delay implementing the ban on neonicotinoids, despite the Agriculture Committee's signal that the decision to ban the pesticides was not based on the best available science. In fact, nowhere in your mandate letter does it actually say that you're required to ensure decisions are based on science, facts, and evidence and serve the public's interest. But your decision to stick with the implementation of the ban despite a lack of science, it does set a dangerous precedent. And with the upcoming legalization of marijuana, we know that the science is very clear. It says the brain develops until the age of 25. Minister, will you forego science in favor of special interest groups in this case too? And what are you doing to ensure that your decisions are science-based?
Well, thank you. I'm concerned that perhaps you've conflated a few issues that aren't necessarily fitting together nicely.
It's based on science, and
the reality is decisions have to be made based on science. You referred to pesticides on a couple of different matters. One is the matter of imidacloprid, which is a neonicotinoid, which is where there's been a draft recommendation that has been tabled. There has not been a final decision made on that, but that decision related to that was based on science. And then you talked about other pesticides related to cannabis, which is an entirely separate issue.
But please, if I can clarify, because I think you're misunderstanding. The question is on marijuana. And the science is very clear, and I think we all know that the brain develops until age 25. Now, there's been all kinds of leaks coming out of your caucus. You're bringing legislation forth soon. And for the health and safety of Canadians, what they expect the Minister of Health and Health Canada to be looking at is the health and safety side of it, not for ease of delivery or access. So in the neonicotinoid issue, the Ag Committee was clear, saying that it wasn't science based on the best available science, but you still upheld that ban. And the concern is, are you going to be basing the age of access of marijuana based on science or special interest groups? And I think Canadians need to know where you stand on that.
Okay, so thank you for clarifying. I think I've understood your question a little bit better now. So your question is in terms of the concerns of young adult brains and cannabis, and whether we will use science as a guide. Correct. Is that right?
Yes.
Okay, so one of the things that you have to that I think all colleagues have to understand is the science as it relates to the data that we have around the use of cannabis in amongst Canadians. You know that we have the highest rates in the world of use, and the most recent data that has just come out, this is scientific data, is that the group that has the highest use in the country is the 18 to 24-year-old population, in which case 30% of Canadians in that age group currently use cannabis. So here's where the science is important to us, is to recognize that these young Canadians are using cannabis to a very large extent. Of course, our legislation is not tabled yet, but what we need to do is to recognize that reality and that truth, and that when you see the legislation come forward, I think it's important to recognize that when we take a public health approach to a matter like cannabis, that we need to not confuse the legalization of products with whether or not products are completely without risk. There are a whole range of products that are available to Canadians, including tobacco and alcohol, which are substances that are absolutely not without risks, and in the case of tobacco, in fact, have well documented risks associated with them. 1 in 2 users of tobacco will die because of that. So because a product is legal does not necessarily mean it's without risk. And so that, taken together with the information that we have about the high rates of use, means that sometimes the smart, science-based public health approach means that we have to say to Canadians, there are products that are available, the science says that there may be risks associated with them, and we have a responsibility to educate Canadians and make sure that they're kept safe.
Very quickly.
Well, there's still a lot to be learned, and just like I said, from the health and safety of Canadians, I think if you look at the stats in the last 10 years, it's gone down for that age group. I think it was 40% down to 33% now. So perhaps what we were doing the last decade has helped decrease the numbers. The concern, Minister, is that if you're going to be putting legislation out, you can compare it to alcohol, you can compare it to cigarettes that are already out there. But why would we want to start a new product out there where we're very sure at age 25, up to age 25, it can be devastating health effects? Why would we choose numbers perhaps 7 years earlier than that?
Well, as I say, I don't want to presuppose what the legislation is going to look like, so I'd be happy to give you some more details on that once the legislation is available.
I understand, Madam Minister, you have to leave, but if you had 8 more minutes, we could complete a whole round of questioning, but if you don't have it, we understand.
Well, where's my team? Do we have to go? Yeah, I think I'm a few minutes late already for my next meeting, if you'll forgive me.
Well, no, thank you very much.
You know I will be happy to come back.
We will look forward to that.
Thank you.
All right, thanks very much again. And Dr. Elson, you're up.
All right, thank you. And well, thank you, Minister, for coming. And I'll start asking my questions of the board since you have to leave. But again, thank you. Now, in regards to the increased funding for mental health, as like Dr. Philpott, we share the same profession. Now, mental health is a very important predisposing factor for a number of other issues. We know that a lot of people with substance addiction problems, in fact, it comes down to a mental health problem. A large proportion of the homeless are, in fact, inadequately treated mental illness. There are a lot of people who their untreated mental illness puts them in the justice system. Now, this is a bit of an assumption, but I think we can reasonably make this assumption that these investments in mental health would have some savings on these other services, the justice system, the drug abuse and addiction, homelessness. Are there any estimation of the projected savings to these systems from these investments in mental health?
I don't have immediate access to that information. I mean, I think there is a presumption that there will be downstream savings to the healthcare system and elsewhere, but we still have to do some work with the provinces and territories to determine exactly where the funds will go. I mean, I think the government's indicated, and certainly there's been a lot of support among PTs for investments in particular in youth, and so we have a sense that that will be an area of priority, but we still have some work to do to figure out exactly kind of jurisdiction by jurisdiction where the funds will go. So I think we'll probably need to do some of that before we can get a better handle on what exactly it might mean in each jurisdiction. I don't know if maybe the Public Health Agency wants to talk a little more broadly about this issue.
I can't speak to specific figures, but obviously if we were on the upstream side, taking a public health perspective, looking more on prevention and promotion, particularly in the young, the lifetime savings is going to be quite significant.
All right, thank you. Now, in regards to investments in harm reduction, this is going to be a similar question. And perhaps there's some data because we've had some limited experience with this. We do know that one of the, we've talked a lot about, supervised consumption sites and the prevention of fatalities when people overdose. We also know that there is a harm reduction aspect in the supply of clean injection equipment, meaning that this would prevent the transmission of bloodborne diseases. We know that a single infection of HIV is going to cost several $100,000 in the life of the patient. A single case of hepatitis C, if adequately treated, is going to cost several $100,000 a year per patient. In the supervised consumption sites that have existed, is there any data on the decrease in the rates of transmission of bloodborne diseases in these centers?
Yes, I don't have immediate access to the detailed figures, but there is a substantial body of evidence that shows the efficacy of these kinds of facilities when they're properly set up and run. That would include, the Insight facility here in Canada. I mean, there's been obviously work done over the last 10 years or so to look at the impact of that facility. In fact, and I'd be happy to do it again, but I had been asked a similar question some time ago by the committee, and we've actually tabled a fairly substantial amount of the empirical evidence here, so I'd be happy to share that again directly. But there's a large body of academic and other research studies that show pretty definitively that supervised consumption sites, lower crime, reduced rates of infection, reduced rates of overdose. So I think as a ministry, kind of as Health Canada, we're pretty confident that the data show that these are effective facilities.
Okay, thank you. Now, is there a figure, even just ballpark, on the costs of operating, the annual costs of operating Insight? Do we have an estimate somewhere in that?
I'm sorry, I don't have that immediately available. We may be able to get that for the committee.
Okay, yeah, and what I would like, if possible, since we know what I'm hoping to do is to see if at some point in the future we have data to show that if we are saving the costs of each of these cases of HIV, Hep C, how much this offsets the costs of running these centers. So, okay, thank you. How much time do I have? All right, well, thank you very much.
Okay, Mr. Davies for 3 minutes.
Thank you. In response to a 2015 Auditor General's report, Health Canada pledged to develop an internal report by July 2016 to analyze clinical care access in remote and isolated First Nations communities in comparison to access to health services by non-First Nations communities in similar geographic locations. I'm wondering if you'll give an undertaking to provide a copy of that report to this committee.
Sorry. Yes, what I can say is there has been active work underway to respond to the Auditor General's report, so I can certainly give you an update on where we're at with that.
I don't really want to, I just want an undertaking that when the report is done, the committee will get it. Can you give us that undertaking?
Can I take that back and come back to the committee? I just don't know what state that report might be in at the moment, but I can assure the member that we are working very diligently on the AG's recommendations, and I'd be happy to provide whatever we can.
I understand that. I know you're working on it. That's why I want to know if, when it's done, we can get a copy of it. That's my question.
Right. And I'll get back to the chair on that. Thank you.
Second, in the minister's mandate letter, we know that she was tasked with producing plain package tobacco legislation. We know that every month that young Canadians start smoking and that many of those people will develop serious health illnesses and die, actually. We know that. So every month, we also know that plain packaging for tobacco products actually is effective in preventing people from starting smoking. So can you tell us when we're going to see plain packaging tobacco legislation introduced in the House?
Well, I think I'm just looking at my latest notes in this, so forgive me.
It's okay.
But I believe our plan is to move ahead on plain packaging relatively expeditiously. We have legislation that is before the House now in S5 that actually will give us some additional authorities needed to actually take action on plain packaging, and we would be doing this largely through regulation. So I don't think you're going to be seeing kind of a plain packaging bill kind of as a standalone. The legislation we've already brought into the House actually will give us some extra oomph that will be needed, but we would be looking at probably largely regulatory measures to move ahead.
Okay.
So I just want to underline we are entirely dedicated to getting this done and getting it done as quickly as possible, but we would not envisage another bill that would need to be brought forward for that.
Any idea when the regulations might be? I mean, what I'm looking for is when will this be enforced in Canada? It's been 18 months since the mandate letter was given. It's a year and a half. People are starting smoking, they're dying. When are we going to see actual action taken?
I'll come back with kind of what the proposed timetable is. I don't have it immediately at my fingertips, but...
Okay. My final question is on overdose prevention sites. As you know, in Vancouver, there's been at least two supervised consumption sites that have popped up in Vancouver and are operating, and they're operating illegally. It's only through the courage of the people who are staffing those at great risk to themselves, sometimes their professional credentials, but they're doing it because they know that these are saving lives. Has there been any consideration given to the health minister actually granting an exemption, an emergency exemption to those overdose prevention sites that we know are operating, that we know are saving lives, but you're forcing to act illegally without that exemption?
What I can say is that we are in receipt of a number of applications for these supervised consumption facilities, including a number in BC. As the minister, I think, indicated, we've made a commitment to process those as expeditiously as possible within the confines of the law. In a lot of cases, we're actually kind of waiting on things from the proponents in order to be able to move forward with our review. We're very hopeful in the coming weeks to be able to put in place some additional transparency measures to kind of give people a sense of where various applications are in the queue.
Mr. Kennedy, can I just interrupt you?
Yep.
These are unique cases. These are operating now. I'm not talking about people who want to open them and they're under the current application process. I'm talking about two sites that you know are operating right now in Canada. Does the minister have the power to grant an exemption if she wanted to those sites that are operating right now, like right now?
I think what the government has been pretty clear on is its willingness to move as expeditiously as possible to approve new supervised consumption facilities, and that's what we're working on, and that's the conversation we're having with British Columbia.
Time's up. Now, that completes our official round of questions, but in the past, when we had the same circumstance, we had excellent witnesses and time left, we established there's another round of 4 questions at 5 minutes each. So if that's consensus of the committee, is that all right with everybody?
I'm sorry, Mr. Chair, can you repeat that?
What we did the last time this happened was we took another round of 4 questions in the order of the original round, but 5 minutes each, not 7.
Do we not have time to do 7?
I think we have time to do 7, but we don't have time to do a full round. So we could do another round of 7 questions.
Couldn't we just do another first round of 4 times 7 minutes because we have 45 minutes?
Yeah, is that the consensus? All right. So we're going to start our questioning with the Liberal Party. Do we have an interested questioner? Mr. Oliver.
Okay. Great. Well, if anybody else wants to share with me, let me know. So I wanted to talk about the, first of all, it's great to see health accords being reintroduced in Canada since I think it was 2004, since we've had health accords in place. That there was a lapse, and good to see the provincial and federal and territorial governments working together again to get agreements. I was wondering, starting with mental health. So a significant amount of funding has flowed, and there's always a worry that when that mental health flows out, it's intended for mental health, but then it gets redirected, and you'll see it can be used in different other areas in the health profile. So are you working on measures to ensure that the provinces and territories use the mental health funding specifically for mental health programs? And have you put in place any metrics, any measures that sort of performance indicators that would track to see whether the investment has helped people that have that are suffering from mental illness?
So as the government indicated in the various news releases announcing the achievement of an agreement on funding with each jurisdiction, you may have noticed there was some language in there about working, kind of the next step being to work on targets and indicators and so on. So that is exactly the conversation that we are having with the provinces and territories. And I think the minister and the government generally have been pretty clear about this right from the outset, that there's a desire to put money in to help, transform the system, but that part of that is going to require that there be agreement on what the funds be spent on, and that there be some accounting to Canadians for the results achieved. So that's the conversation we're having now. And indeed, the hope, more than a hope, kind of the objective is to have a good sense of where the money will go, measures that we can report publicly on, and then kind of mechanisms that everybody's comfortable with to allow that reporting to take place. And that's the conversation we're engaged in right now.
Okay, great. So can you give some examples then of what those measures, indicators might be? I know they're under negotiation, but can you just share with the committee some of the specifics that from your ministry that you've been looking at?
As you said, I don't want to sort of prejudge what the provinces and territories might wish to see in the conversations we're having. But I can indicate, for example, we've been pretty clear with our partners, and they seem pretty open-minded about it, that we would like to see an important investment in mental health services aimed at young people. There's a lot of research that for young people with mild to moderate symptoms, if you can kind of get to them early on, it has a really beneficial impact later in life, whereas if they continue with their difficulties, they kind of get progressively worse. So that's something the PTs themselves have indicated that they're interested in. So you could imagine an indicator, for example, about how long it takes for young people, say under the age of 25 or something, to get access to basic mental health service, how widespread is the access, that sort of thing. And those are the kinds of conversations that we're having now.
Okay. Mr. Chair, Mr. Khan would like to have 30 seconds of my time, so could you let me know roughly when I have about 30 seconds left, and I'll send it to him. Second question was around for CIHR. So there's been an investment of about $1 million over 5 years to do research into gender and sex effects of opioid use. Just wondering how that's progressing, how many studies have been identified, where is that at?
Thank you for your question. Indeed, the issue of gender, sex, and opiate use is an important one for CIHR. Our Institute of Gender and Health is looking at this matter on a regular basis and investing in a significant amount of areas. Most recently, we attended the Opiate Summit that was co-hosted by the Minister, where we committed to launching synthesis grants in the area of opiate addiction, specifically to have a better understanding of some of the emerging science around the issue of opiates addiction specifically, and how the elements of gender and sex affect opiate use. its treatment. So these are commitments that we have made that we are launching very shortly as part of a broader package of initiatives that we're working in the space.
Thanks. And over the last number of years, I think before the current government, there was a lot of reduction to research funding. There was cutbacks to CIHR support. There was a slow sort of degradation of research capacities at universities and at health science centers and across Canada. Do you have any sense, where are we at now? Do you track the number of PhDs that we have, the number of PhD students on track? Are we recovering in terms of health as a center of health research here in Canada, or are we still sort of in that area where we were losing more than we were gaining?
Thank you for your question, an important one indeed for us in the research community. You're quite correct that since approximately 2007 and 8, the CIHR's budget has been effectively stable at approximately $1 billion. And this has resulted in a loss of purchasing power in terms of inflation. That said, we've been able to offset some of these shortcomings, I think, by leveraging significant investment from many of our external partners. For instance, the investment levels from non-federal partners has grown by more than 50% to approximately $96 million in fiscal year 2014-15. As you know, federal budget 2017 also addressed two significant issues, climate change adaptation and the substance abuse area, for which there are investments of funds. And of course, we do wait for the soon-to-be-announced review of fundamental science, and we'll be working with the minister and the government in terms of the information there. If there are specific questions around the number of PhD graduates and the like, we'd be happy through the chair to provide that information to you.
It'd be great to get a report just on the status, the health of the sort of human resources that we have at the academic level in health science research. And
if you permit, Mr. Chair, I can, as a follow-up, I should mention in budget 2016, we also allocated a specific, so backing up, it's important that as we look at the research enterprise that we understand the entirety of the continuum of researchers and the importance that we continually invest on a year-to-year basis to ensure that these young graduates make their way into the health research community. We have committed a specific amount of dollars, $30 million, to ensure that early career investigators are particularly focused for ensuring granting around health research to ensure that that pipeline maintains its growth on a going forward basis. And that, along with other initiatives that we are doing, whether it be in our postgraduate programs and working with the institutions there. So happy to provide additional information. That's useful for that.
Mr. Kung, very quickly. Yeah.
Thank you, Mr. Chair. I just want to urge the federal government, the Minister of Health, that funding designated for mental health and home care, it should only go to mental health and home care initiatives. Because I can speak from experience. Mental health clinics in Calgary. I'm from Calgary, and home care, they do a great job, and they're doing a wonderful job to keep the patients out of the hospitals. So I'm speaking from personal experience. So that funding should be designated to mental health care and home care. That's where that funding should go to. Here. Thank you very much.
Thank you very much. Dr. Carey, you're going to split your time with Mr. Weber, I understand.
Yep, thank you very much. And I just want to clarify too, maybe to Mr. Kennedy, if you could clarify for us, my colleague said, how the change for the Health Accord, the collaborative approach, could you confirm, have all the provinces signed on to the Health Accord?
At this point, Manitoba is there's still discussions ongoing with Manitoba on this issue.
Yeah. Okay, just wanted to clarify that collaborative approach. I was questioning the minister about mandatory testing. I just wanted to clarify because I didn't quite understand your answer on it. The question is the testing of medical marijuana mandatory, yes or no? From the article, and the reason I'm asking, it actually says in the article, Health Canada gave no clear answer in its briefing as why it wouldn't make testing mandatory for licensed producers. One reason given by the senior official was that he believed there is only about 3 labs in Canada that could perform such testing, and there would be a backlog. Given the ramping up of the medical marijuana field, is it mandatory now, and if it's not, is it because you're worried about a backlog?
So it is mandatory that licensed producers who wish to use pesticides on their crop, that they only use one of the, I think it's 14 chemicals that are available. So there is a short list, and the rules require that if they wish to use it, those are the only ones they're allowed to use.
Yep.
And that's a condition of their license. And we do regular inspections to kind of make sure that they're doing things as appropriate. We have not, until recently, had a program as the inspection kind of agent to be specifically testing lots of the product to ascertain whether or not they are staying within that legal requirement. We have started randomized.
So the answer is no.
The answer is we've started randomized testing to determine whether people are complying with the rules as they exist. As I mentioned earlier, we have had a very good track record of compliance with the rules generally. We've had a couple of incidents recently involving pesticides. I would note that in each of those cases, there were recalls initiated, all of the clients were contacted. The department did a risk assessment, and the risk assessment determined that the risk presented by these breaches was actually very low. The pesticide involved, the one that you're referring to in the media article, is called myclobutanil, which is actually used on food crops. We did an assessment about one of the concerns that had been raised, which has been in the press, is around what happens if you burn this. So we looked at that because obviously people inhale.
It turns into hydrogen cyanide,
Yes.
which is extremely dangerous. And that's why I'm asking. And from your answer, if I can clarify, because I have some more questions I'd like to ask you. So I asked you if you do mandatory testing. You said that the companies have a list of things they can use.
That's right.
But you haven't required it. Health Canada does not go in there and mandatory test these companies. And if they have, I'm just wondering, how often have you done the random testing? And if you don't have those numbers for me, I'm okay with that. You can get back to us.
Yeah, we agreed we would certainly provide those numbers. I think what I would say, though, is that if you were to ask about the inspection regime and the regulatory regime of not just Health Canada, but indeed most regulatory agencies, there's a risk-based element to it. So you focus your resources, because you can't kind of do everything at all times everywhere. It would be prohibitive. You focus on where you see risk.
But with pharmaceuticals, for example, like I believe there is certain testing done, and these patients, many of them have cancer, they have AIDS, and my concern is the demand has increased exponentially in the last few years. And, I don't want to give you a hard time because I know that it's all about the priorities of the government, how much money. I didn't notice any in the estimates, I didn't notice any extra money that you're given to do these inspections. But I think if we're mandating Health Canada, the health and safety of Canadians, we know that this is being given to patients who have cancer, who have AIDS, who are immunosuppressed, that it behooves us to ensure that those products are being tested and not just random. And if they are, I'm just curious, how many times have you actually tested them?
Well, I would be very happy to provide the stats. I don't have them immediately available. With the issue, though, of hydrogen cyanide and the kind of the presence of that, just by way of illustration, the amount of hydrogen cyanide you get from actually burning and inhaling marijuana smoke, which is what, if you're smoking it, that's what is in the order of 500 to 1,000 times higher than the levels that were present as a result of the pesticide residue. So when you look at what's the risk presented in terms of things like hydrogen cyanide, there's actually quite a bit more just from smoking marijuana than was actually in the residue. So we are concerned, as you and others are, about whether producers are complying with the rules. So we are doing this regime to get a better handle on, is this a more systemic problem or was this an isolated incident? But we are very confident that in this case, there's been limited evidence to date that it's anything more than an isolated incident. The risk to Canadians was extremely low. There were recalls initiated. We know because the licensed producers have lists of clients. We were able to reach everybody. And so kind of from a material point of view, does this present a serious risk to Canadians? All of the evidence would suggest no. And so in terms of where we would put additional resources, at this point, we want to start kind of with the randomized testing to get a better handle on kind of is this a broader problem or not.
Well, I appreciate the answer, but if last time we asked Health Canada to get back to us, I think it took about 6 months or something.
You're down to a minute, so do you want to share with Mr.
That my colleague wanted to know that is it going to be 6 months before we get those numbers?
I'll try to get back to you as quickly as possible. I can make that commitment now.
Yeah, please if you could. And with the couple of seconds I have left, For the funding for, it was used as a bargaining tool to encourage provinces to sign on to the health accord. And I was wondering what the federal government does to ensure that the funds designated to support mental health and home care initiatives will not be used for other health care priorities. We realize that this budget, it's totally moved things to the back end, but as we work with the provinces and territories, are the things that you have in there so that will ensure that the funds designated for health care and home care get used for health care and home care.
Yeah, and certainly that the government's been pretty clear about that in its public statements and in kind of what the minister has said publicly and with her colleagues. And certainly the instructions I would be operating under as an official is that is the objective that we want to see achieved. So we have been talking to the provinces and territories around, you know, how do they wish to spend the money in those priority areas, and then how would we account for that publicly? So what kind of indicators would we use to demonstrate that that was happening? So that is certainly the objective, and we'll be trying to pursue that.
Okay.
Time's up. No, time's up. Mr. Davies.
In June 2016, Mr. Paul Mayers, the Vice President of Policy and Programs branch of CFIA, testified to this committee that CFIA inspectors are present every day and during every shift in federally regulated meat slaughter plants. He said CFIA inspectors visit those plants every day, every shift, but they are not present 100% of the time. It is an inspection done every single shift, end quote. In June of 2016, Mr. Bob Kingston, president of the Agricultural Union, indicated to this committee that the statement made by Mr. Mayers was false. Now, in response, CFIA clarified that, and I quote, "While its targets are not met in all cases 100% of the time, it operates at or close to target a significant majority of the time. The nature of CFIA's operations is impacted by fluctuations in demand for service, response to emergent events, and occasional challenges in filling vacancies promptly." Now, leaving aside the question of the discrepancy in testimony, in the 2017 departmental plan, the CFIA indicates that it intends to reduce full-time equivalent positions in the food safety program over the next 3 years. So given that it's recognized that inspection staff have already been stretched and are not present to do, certainly not present in all shifts for meat inspections at slaughter plants, how do you anticipate this cut will affect the delivery of program direction?
Mr. Chair, thank you for the members' questions. Very important. Appreciate the opportunity to follow up on my response to the committee and to further provide insight onto this important issue. Two parts to the answer, if I may. Inspector numbers do fluctuate. Happy to be more transparent about those. We intend to put those up on our website on a regular basis. Seasonal activities, summertime, more intense, we'll have more seasonal inspectors for cash crops, those sorts of things. Most recently, over the winter months with the bovine tuberculosis outbreak, there was a need to reassign resources to deal with that emerging issues. So the numbers do move. That is a part of, I think, the reality and an expectation of this committee that we are nimble and moving to where the risks are to best protect and serve Canadians. So we will do that absolutely moving forward in as transparent a way as we can to make sure that people are confident about what risks we're seeing and where we're deploying our resources. With respect to the adjustments to our budget, I can assure the committee that all of those are related to sunsetting programs. They're related to time-limit initiatives like the introduction of electronic service delivery platforms, so where we used to manually do import certificates, export certificates, those are now being automated, done online. People are able to self-service so that we don't have to have people doing that. So we have a number of resources that are dedicated to standing up of those sorts of infrastructure. There was also money to invest in our labs. So the reductions are planned, they're related to sunsetting programming, and we are making every effort to preserve our inspection resources and prioritize those and not touch them with any of the reductions moving forward.
Are you saying there will be no reductions in FTEs for meat inspectors?
As I said earlier, those numbers will fluctuate.
Yeah.
We do see retirements. In some instances, there will be difficult to staff areas. So happy to be accountable, show you where those numbers are moving.
Thank you.
And our objective is to prioritize and not reduce frontline inspection activities.
Okay.
Absolutely.
Thank you. I think, Mr. Kennedy, I think you may be the right person to ask this about the health accord. The minister made reference to several $billions of federal money being transferred to the provinces for mental health Are there any conditions attached to that money to ensure that the provinces will spend that money in mental health?
Well, that's the conversation we're having right now with the provinces and territories. So, in the announcement that the government made as it kind of reached funding agreements with each province and territory, you would have seen perhaps in the announcement a discussion about how, you know, the next step is to sit down and basically, this is I'm paraphrasing, but to sit down and figure out like how we're going to spend the money, what the targets and indicators will be. And so, indeed, that is the objective. The objective is to ensure that those funds go towards mental health, go towards home care. We will be working on a multilateral agreement with the provinces and territories to kind of put down kind of like, you know, how we would see collectively as governments, how we would see reporting working, you know, how we will set priorities. But then the objective is with each jurisdiction to have a kind of a bilateral agreement, almost like an annex to the broader multilateral document that specifies, let's say in BC, here's how BC is going to spend that money on home care, on mental health, and basically have that level of specificity.
So, Ms. Kennedy, it sounds like the agreements are not done yet. I mean, what if you can't reach agreement on that? I mean, the minister's announced we've come to an agreement with 9 provinces, and so we've done the agreement, we get the fanfare in the media, and here's the amount of money that we're giving to them. But if one of the provinces says, I'm not committing to spending that money for mental health necessarily, what happens to the agreement?
Well, what I can say to date is that there has been, you know, frankly, there's been very good collaboration with the provinces and territories. I can only speak as an official, but, you know, at the deputy minister level and the senior officials, there's been lots of conversations over the last 14, 15 months. Indeed, we've had great suggestions and great discussions with the provinces and territories about what they'd like to see, for example, in the area of mental health. The issue of focusing on youth is something that provinces and territories themselves actually said was a big priority for them.
So do you envision they're coming to an agreement on it?
I think so, yeah. I mean, you know, obviously there's more water to go under the bridge, but, you know, we've had great discussions to date. I think the provinces and territories, every signal is that they're anxious to get moving.
Yeah.
So,
Mr. Kennedy, are there actually written agreements with each province that exist now? And if, like, do they exist now? Is there anything that's been signed between each province as a condition of signing on to the Health Accord? And then second, could we get a copy of those?
Well, there are the announcements that have been made jointly with the various provinces and territories on the funding issue, which is, you know, agreement on the funding levels. We are now working on what you might call the documents related to the content in terms of what. So, for example, again, just to, you know, take province by province, our objective is we will have a signed agreement with BC that, you know, an annex to the kind of broader framework, which would say, here's what we're going to do in BC. And we're working on that. We've been working on that all along, so, you know, I'm not going directly here to a meeting with BC, but we've been working on that all along, and the objective would be in the next, you know, short order, we would have those signed.
Okay, have any been completed between the federal government and any province to date? Not yet, and that's been a function of the discussions that have been ongoing about the money and leading to the budget. So we've been waiting till the kind of budget step was done. We're now actively going back and having that conversation.
Time's up. Dr. Elson.
All right, thank you. I'll be sharing my time with Ms. Sidhu. Now, with the 2017 to 18 departmental plan, one of the priorities, there's an initiative relating to the action plan on opioid misuse. It emphasizes harm reduction, public health, including considerations of the Controlled Drugs and Substances Act, and that this year is going to be just under $89 million for 2017-18. Can you comment on what aspects of the action plan will the spending increase be used to implement? There's an increase of 1.3% here.
So there's a lot of work underway in the health portfolio right now on opioids. So I could give you a catalog of the areas that we're working on that are kind of priorities. The government, as regards the money in the budget, the government has not to date, but my understanding is that'll be happening shortly, come out and publicly said this is a specific breakdown of how the new funds will be spent. So I wouldn't want to preempt the minister or the government in that regard. But some of the areas that are priorities for us, as an example, we have laboratories across the country that do analysis of drug samples that are seized in raids by the police and that sort of thing. Because obviously of the rise of synthetic opioids, the demand for those laboratory services has gone up significantly. Provinces have asked for additional assistance from our laboratories. So one area of priority for us going forward with some of the resources we've received is going to be a substantial increase in the ability of our labs to be able to respond to the opioid crisis. You know, faster ability to analyze substances, you know, perhaps more public reporting, better assistance to provinces, and so on. So that would be one example. We want to, when C-37 goes through, we want to be able to more expeditiously process requests for things like supervised consumption facilities. So that's an area we want to beef up. We have been doing a lot of work on the regulatory side to try to support provinces in enabling access to new therapies, as an example. So that's another area that we've been prioritizing. I know the Public Health Agency has been doing a lot of work as well. I'm sure they could speak to some of the things they're doing. But there's a long catalog of initiatives that we're working on, and we would use the new resources to support those kinds of activities.
Mm-hmm. Okay, thank you.
So one more example, just because I think it's powerful. But and we've been working with an expert panel over the last number of months. But one of the things we're looking at is the monographs for all opioid drugs right now. So this is kind of, you know, obviously, as you would know, this is kind of the label that effectively tells practitioners, you know, what this can and can't be used for. We're looking at whether it would be wise to add additional contraindications to monographs, which obviously would cause physicians, even for off-label use, to think twice about whether to use an opioid where it's definitely contraindicated. We're getting that expert advice shortly. If we were to update product monographs for a large number of opioids, that's obviously a lot of work, a lot of expense. So again, this is an area where we might want to prioritize some of the funds the federal government received for our regulatory system to actually have better labeling, you know, kind of better guidance to practitioners.
All right. And do you anticipate that these funds will be sufficient to fully implement that plan, or do you anticipate we might need more funds for this than what had been allocated in the increase?
I wouldn't want to prejudge, you know, what we may advise the minister, you know, for the next budget round and so on. But I think, you know, we think that the resources that have been provided are substantial and are going to be very helpful in our ability to advance the priorities that the government set out. And this is a top priority, so, you know, where we may feel additional resources are needed, we will do our best to reallocate internally. So I think we're pretty comfortable that we've received a significant increase in funding.
All right. Thank you. And I'll hand the floor over to Ms. Sidhu.
Thank you. My question is to Public Health Agency of Canada. In 2017-2018, I know $2 million being transferred to CIHR to support Canadian Immunization Research Network. What step Public Health Agency of Canada is taking to improve immunization coverage and reducing vaccine preventable disease rates?
Mr. Chair, thank you very much for that question. So we did receive $25 million over 5 years to improve vaccine coverage rates. And there are several different components to that. One is to reset those targets, make sure that they're still where we want to hit, have better ways of methodology for estimating vaccine coverage. We're also supporting up to $1.2 million, up to 6 research teams for 2 years to look at identifying where those under-immunized populations are and why they are under-immunized, the reason behind that. We are transferring $2 million to partner with the CIHR to leverage on an existing network, the Canadian Immunization Research Network. That research network has a lot of great scientists and collaborating across Canada. It already exists. They will look at, from a scientific evidence perspective, behavioral characteristics of vaccine acceptance and methodologies to improve uptake. And finally, we will have an immunization partnership fund. That fund will leverage provinces and NGOs and other stakeholders to actually look at implementing interventions that would work to increase that immunization coverage rate.
And also, can you explain taking action to address antimicrobial resistance in Canada? antimicrobial resistance in Canada, what role does Public Health Agency of Canada play in both development and implementation of this framework? And can you explain the detailed action plan? What step you're taking?
So we already have in place a federal framework and action plan. I've been playing some leadership role in putting together a cross-sectoral agriculture, animal health, human health, pan-Canadian framework. And that involves all of the people here, the departments, the health portfolio sitting here, CIHR, Health Canada, CFIA, as well as other government departments that will come up with the pan-Canadian framework. We're targeting that to be ready around May, which is our commitment to the World Health Assembly to deliver that. After that, we will have a more precise look at the specific actions. They are in the areas of better data and surveillance on the agriculture and human health side, looking at how we improve the use and appropriate use of this very important resource, what we call stewardship, improve infection control practices, and also research and innovation, looking at diagnostics, looking at new tools to combat antimicrobial resistance.
Thank you.
Okay, time's up. And that concludes our questions, and we want to thank the witnesses for their attendance today and their patience with us, and I want to thank the members of the committee for their questions. I have a couple little committee issues.
Just very short.
Yes?
There were a number of questions asked today to our guests regarding follow-up, and I'm just wondering if we can agree on an appropriate time for the follow-up to come back to us and to have it come through you, Mr. Chair, so you can get it to us. But I know that in the past it's taken quite long to get information on questions we've asked, and we're hoping to get at least something decent in a time frame, perhaps 2 weeks. You can come back to us with the questions and the figures that we've asked for, specifically on Lyme disease.
Is that 2 weeks? Is that a reasonable deadline? We've recorded all the questions, all the information that's required.
Our suggestion, just conferring with colleagues, would be, I think there's a lot of material, certainly in my area, that we could do this in 2 weeks, I think, fairly easily. Dr. Matani was saying there may be some data that might take a little longer to get, so if we could commit to try to get everything in 2 weeks. Well, if not, we can deliver what we can, and then with a second follow-up tranche, part 2 or something, if that's acceptable to the committee.
Is that acceptable? That works.
Should there be a motion put down with regard to time?
We have a commitment,
okay,
and we'll follow up on it. But thanks very much again. Thank you very much. Now, on committee business, we have canceled our meeting for April the 13th. I want to make sure everybody knows that. But we need a deadline for witness lists for the thalidomide study, which is on the 9th and the 11th. And I'm going to propose that we have that deadline as of next Thursday. That's the last sitting day of next week before the 2-week break. So could I have a motion that the April 13th would be the deadline for thalidomide witnesses? Yes, okay. All in favor of the motion for the deadline? All opposed? Passed. Okay, so Thursday's the deadline for thalidomide witnesses. And that's it. Thanks very much, everybody.